There exists a peculiar irony in the world of health foods, where the smallest seeds can pose the largest threats. Chia seeds measure barely 2 millimeters across, yet within their diminutive shells lies a capacity for expansion that defies their appearance. When these seeds encounter moisture, they undergo a transformation so dramatic that it borders on the alarming, swelling to nearly 30 times their original size, absorbing liquid with an almost aggressive efficiency. For younger bodies with robust digestive systems and quick reflexes, this expansion happens where it should, in a bowl or glass before consumption. But for those whose bodies have accumulated decades of wear, whose systems move more slowly and respond less predictably, these tiny seeds can become something far more sinister than a nutritious addition to breakfast. The marketing of chia seeds has been relentless and largely one-sided. Wellness influencers showcase them in crystalline jars, stirred into jewel-toned smoothie bowls, or layered into photogenic puddings that promise vitality and longevity. The narrative is always the same: ancient superfood, packed with omega-3 fatty acids, brimming with fiber, loaded with protein. What the glossy images and enthusiastic testimonials rarely mention is that these same properties, the water-absorbing capacity, the dense fiber content, the concentrated nutrients, can turn treacherous when consumed incorrectly. The difference between a health-promoting food and a medical emergency often comes down to nothing more than preparation method and dosage, yet this distinction receives scant attention in the rush to embrace the latest nutritional trend. Understanding why chia seeds pose particular risks requires a brief examination of what happens inside an aging digestive system. After 65, the body's ability to produce saliva diminishes, leaving the mouth drier and making swallowing more difficult. The esophagus, that muscular tube connecting throat to stomach, loses some of its contractile strength, meaning food does not move downward with the same efficiency it once did. Stomach acid production decreases, slowing the breakdown of food particles. The intestines themselves develop weaker peristaltic waves, those rhythmic contractions that push digested material through the system. In essence, everything slows down, becomes less responsive, less forgiving of dietary missteps. Into this already compromised environment, a handful of dry chia seeds represents not nourishment but potential catastrophe. The first critical error occurs when someone sprinkles these seeds directly onto cereal, salads, or yogurt without pre-soaking them, or worse, swallows them dry with a glass of water. The seeds appear harmless in their dormant state, no different from poppy seeds or sesame seeds scattered across a bagel. But chia seeds are fundamentally different. They are hygroscopic, meaning they actively pull moisture from their surroundings. The moment they land on a moist surface, the tongue, the throat, the stomach lining, they begin their expansion. For someone with reduced saliva flow, this expansion can begin in the throat itself, creating a sensation of blockage that escalates rapidly from uncomfortable to dangerous. Medical literature documents cases where emergency intervention became necessary, where scopes had to be inserted to physically remove swollen seed masses from airways. What began as a healthy choice ended in an ambulance, a sobering reminder that natural does not automatically mean safe. Even when the seeds make it past the throat successfully, consuming them dry sets up a chain reaction of digestive distress. As they travel through the stomach and into the intestines, they continue absorbing whatever moisture they encounter. In a system already moving slowly, this creates congestion. The fiber that was supposed to promote regularity instead forms a dense, difficult-to-pass mass. Bloating becomes severe, almost balloon-like in its intensity. The abdomen distends and hardens. What was meant to clean the system instead clogs it, sometimes requiring medical intervention to resolve. The discomfort can last for days, accompanied by cramping and a sensation of fullness that makes eating anything else nearly impossible. The solution is deceptively simple. Soaking the seeds for 15 to 30 minutes before consumption allows the expansion to happen outside the body, creating that characteristic gel that moves through the system gently rather than obstructively. The second mistake compounds the first through sheer enthusiasm. When people discover a food touted as beneficial, they often adopt a more is better philosophy, doubling or tripling recommended serving sizes in the belief that increased intake will accelerate results. With chia seeds, this approach backfires spectacularly. A single tablespoon contains approximately 5 grams of fiber, meaning 2 tablespoons provide 10 grams, nearly half the daily requirement for most adults. For someone already consuming vegetables, whole grains, and fruits, adding multiple tablespoons of chia seeds daily creates a fiber overload that the digestive system simply cannot process effectively. The consequences manifest as severe constipation rather than the improved regularity that was promised. Fiber functions by absorbing water and adding bulk to stool, which in moderate amounts facilitates smooth passage through the intestines. But when fiber intake becomes excessive, especially in a system with reduced motility, it creates the opposite effect. Instead of softening and moving through, the fiber-laden mass hardens and stalls. The intestines struggle to generate enough force to propel it forward. Days pass without a bowel movement, and the discomfort escalates from annoying to alarming. In severe cases, this leads to impaction, a condition where hardened stool becomes lodged in the colon, requiring manual removal or other intensive medical procedures. Stories abound of people who embraced chia seeds with such fervor that they ended up in emergency rooms, bewildered by how something so natural could cause such acute suffering. Beyond digestive complications, excessive chia consumption carries metabolic risks that receive less attention but deserve serious consideration. These seeds are surprisingly calorie-dense, with each tablespoon containing roughly 70 calories. 4 tablespoons daily adds nearly 300 calories to the diet, a significant amount for sedentary seniors whose metabolic rates have naturally declined with age. What begins as a health intervention can inadvertently contribute to unwanted weight gain, particularly when people fail to account for these additional calories. Moreover, the blood sugar-lowering effects of chia seeds, beneficial in moderation, become problematic in excess. For those taking diabetes medications, large amounts of chia can drive glucose levels too low, creating episodes of dizziness, confusion, and weakness that can result in falls or worse. The key lies in restraint, in understanding that 1 to 2 tablespoons daily provides all the benefits without overwhelming the body's capacity to process them safely. The mistakes people make with chia seeds extend beyond quantity into the realm of technique, where seemingly minor preparation choices create major consequences. One particularly hazardous practice has gained popularity through social media, where health enthusiasts demonstrate swallowing a spoonful of dry seeds directly, chasing them with water as though taking medicine. This approach combines maximum risk with minimum benefit, creating conditions almost perfectly designed to trigger the expansion problems discussed earlier. The seeds hit the throat in their compact, dry state, and then encounter the water meant to wash them down. But instead of moving smoothly into the stomach, they begin their swelling process mid-transit, adhering to the esophageal walls and forming obstructions that can block the airway partially or completely. The esophagus in older adults lacks the muscular vigor of youth, making it less capable of forcing material downward when complications arise. When chia seeds begin expanding in this confined space, they create a sensation of choking that can escalate into genuine respiratory distress. The gel coating that forms on the seed surfaces becomes sticky, causing them to cling together and to the surrounding tissue. Attempts to swallow or cough often make the situation worse, compacting the mass further. Emergency medical reports describe cases where patients arrived at hospitals unable to swallow their own saliva, with imaging revealing solid plugs of expanded chia seeds lodged in their throats. The removal procedures are invasive and frightening, involving scopes inserted down the esophagus to physically extract the obstruction piece by piece. What was supposed to be a quick health boost becomes a traumatic medical emergency, one that could have been entirely avoided through proper preparation. Even when dry seeds successfully reach the stomach, they create problems that manifest more slowly but with equal severity. Without pre-soaking, the seeds draw moisture from the digestive system itself, absorbing stomach acid and intestinal fluids as they expand. This internal expansion causes intense bloating that can persist for hours or days, creating pressure that makes breathing uncomfortable and eating impossible. The stomach distends visibly, becoming hard and drum-like to the touch. For seniors with existing digestive conditions such as diverticulosis or irritable bowel syndrome, this added stress can trigger flare-ups that require weeks to resolve. The simple act of soaking seeds beforehand eliminates these risks entirely, allowing the expansion to occur in a controlled environment where it can be observed and managed. Yet people skip this step out of impatience or ignorance, prioritizing convenience over safety in ways they would never consider with other aspects of their health. Temperature represents another dimension of preparation that receives insufficient attention despite its significant impact on chia seeds. Some people believe that adding seeds to boiling water or freshly brewed tea will somehow enhance their properties or kill potential contaminants. In reality, high heat destroys the delicate compounds that make chia seeds valuable in the first place. The omega-3 fatty acids, particularly alpha-linolenic acid, break down rapidly when exposed to temperatures above 140 degrees Fahrenheit. These fats undergo oxidation, a chemical process that not only eliminates their anti-inflammatory benefits but potentially creates harmful byproducts. Antioxidants similarly degrade under heat, losing their protective qualities and leaving behind nutritionally diminished seeds that offer little beyond fiber and calories. The textural changes caused by hot water create additional problems. When boiling liquid hits dry chia seeds, they absorb it unevenly, forming clumps and irregular gel pockets rather than the smooth, uniform consistency that results from gradual soaking in cool water. These clumps are harder to swallow and more likely to cause digestive discomfort, creating pockets of concentrated fiber that the intestines struggle to process. Some people report nausea and bitter aftertastes when consuming chia prepared with hot water, symptoms that disappear when they switch to room temperature soaking. The science supports this observation. Heat alters the protein structure of the seeds and can release compounds that taste unpleasant while simultaneously destroying the ones that provide health benefits. The proper method involves soaking seeds in cool or lukewarm water for at least 15 minutes, allowing them to hydrate gently and retain their nutritional integrity. Storage duration introduces yet another hazard that often goes unrecognized until symptoms appear. Chia pudding has become a meal prep staple, with people preparing large batches on weekends to eat throughout the following week. This practice seems logical from an efficiency standpoint: make it once, enjoy it multiple times, but it ignores the perishable nature of hydrated seeds. Once chia seeds absorb liquid and form their gel coating, they create an environment where bacteria can flourish. Even when stored in refrigerators, these preparations begin deteriorating after 48 to 72 hours. The moisture content, combined with residual warmth and the organic matter of the seeds themselves, provides ideal conditions for microbial growth. The early stages of spoilage are not always obvious. The pudding may look normal, with only subtle changes in smell or taste signaling that something has gone wrong. By the time sourness becomes pronounced or texture changes noticeably, bacterial populations have already reached dangerous levels. For seniors whose immune systems operate less efficiently than they once did, consuming even mildly contaminated food can trigger severe gastrointestinal distress. Cramping, diarrhea, and nausea can last for days, leaving the person weak and dehydrated. In extreme cases, foodborne pathogens like E. coli or Salmonella can establish serious infections requiring hospitalization. The solution is straightforward but demands discipline: prepare only what will be consumed within 2 days, store it in airtight containers, and discard anything that smells or tastes off, regardless of how recently it was made. The omega-3 fats in chia seeds present their own storage challenges. These compounds are highly unstable, prone to oxidation even under refrigeration. As days pass, the fats begin turning rancid, developing off flavors and losing their beneficial properties. What remains is a food that provides calories and fiber but lacks the anti-inflammatory, heart-protective qualities that justified its consumption in the first place. People eating week-old chia pudding are essentially consuming nutritionally depleted food with increased contamination risk, the worst possible combination. Fresh preparation ensures maximum nutrient retention and minimum bacterial presence, transforming chia from a potential hazard into the superfood it is supposed to be. The inconvenience of more frequent preparation is minor compared to the consequences of ignoring these time-sensitive factors. The most insidious danger lurking within chia seeds has nothing to do with preparation methods or portion sizes, but rather with how these seemingly innocent seeds interact with medications that millions of seniors take daily. This intersection between food and pharmaceuticals creates risks that rarely appear in wellness articles or recipe blogs, yet represent the most serious threat to health that chia consumption poses. The problem centers primarily on diabetes medications, a category of drugs prescribed to enormous numbers of older adults struggling with blood sugar regulation. When chia seeds enter a system already influenced by glucose-lowering medications, they do not simply add to the therapeutic effect, they can amplify it to dangerous, even life-threatening levels. Chia seeds contain soluble fiber that forms a viscous gel in the digestive tract, physically slowing the absorption of carbohydrates and preventing the rapid glucose spikes that follow meals. For people managing diabetes through diet alone, this property offers genuine benefits, helping to maintain steadier blood sugar levels throughout the day. But for those taking metformin, sulfonylureas, or insulin, drugs specifically designed to reduce blood glucose, the combined effect can drive sugar levels far too low. Hypoglycemia, the medical term for this condition, manifests initially as shakiness, sweating, and confusion. If left uncorrected, it progresses to loss of consciousness, seizures, and potentially fatal outcomes. The danger is compounded by the fact that aging bodies respond more slowly to hypoglycemic episodes and recover less efficiently, meaning what might be a brief uncomfortable incident for a younger person becomes a prolonged medical crisis for someone over 65. The terrifying aspect of this interaction lies in its subtlety. People do not recognize they are creating a problem because both the medication and the chia seeds are individually appropriate and beneficial. The medication controls diabetes effectively when used alone. The chia seeds provide fiber and nutrients without causing issues in people not taking glucose-lowering drugs. But combined, they create a synergistic effect that neither doctors nor patients anticipate unless specifically discussed. Someone might eat chia pudding for breakfast, take their prescribed diabetes medication as directed, and then find themselves dangerously hypoglycemic by mid-morning, bewildered by symptoms they cannot explain. Family members discover them confused or unconscious, unable to communicate what went wrong. Emergency responders find critically low blood sugar readings but no obvious cause until the dietary history reveals recent addition of chia seeds to the daily routine. Blood pressure medications present similar interaction risks, though they receive even less attention in discussions about chia seed safety. These seeds contain compounds that can lower blood pressure naturally, a benefit for people with mild hypertension who are not on medication. But for seniors already taking antihypertensive drugs, which includes vast numbers of older adults, adding chia seeds can cause blood pressure to drop excessively. The result is orthostatic hypotension, a condition where blood pressure falls dramatically upon standing, causing dizziness, lightheadedness, and an elevated risk of falls. For elderly individuals whose bones are already fragile and balance already compromised, falling represents one of the most serious health threats they face. Hip fractures, head injuries, and other fall-related traumas often mark the beginning of rapid health decline in this population. The connection between a seemingly healthy dietary addition and a devastating fall may never be recognized, leaving doctors and families puzzled by the sudden deterioration. Blood-thinning medications like warfarin present yet another area of concern. Chia seeds contain vitamin K, which plays a crucial role in blood clotting. For people on anticoagulants prescribed to prevent strokes or manage heart conditions, maintaining consistent vitamin K intake is essential for medication effectiveness. Suddenly adding chia seeds to the diet introduces variable amounts of this vitamin, potentially interfering with carefully calibrated drug dosages. The blood becomes either too thin, increasing bleeding risk, or not thin enough, raising the possibility of dangerous clots. Regular monitoring can catch these changes, but only if doctors know to look for them, and many patients never think to mention dietary additions when discussing their medication management. The broader issue extends beyond any single drug interaction to encompass the reality that most seniors take multiple medications simultaneously. Each prescription carries its own interaction profile, its own list of foods and supplements that may enhance or diminish its effects. When someone takes 5, 7, or 10 different medications daily, a common scenario in geriatric care, the potential for unexpected interactions multiplies exponentially. Chia seeds might interact with one drug, 2 drugs, or create a cascade effect across several medications simultaneously. Predicting these interactions requires comprehensive knowledge of pharmacology and nutrition that even healthcare providers may lack, particularly given how recently chia seeds have entered mainstream dietary consciousness. This complexity does not mean seniors must avoid chia seeds entirely, but it demands a level of caution and communication that is often absent from the enthusiastic embrace of superfoods. Before adding chia seeds regularly to the diet, anyone taking prescription medications should consult their physician or pharmacist. This conversation should include discussion of current medications, typical dosages, and monitoring protocols to watch for signs of interaction. Blood sugar levels should be checked more frequently when introducing chia seeds into a diabetic diet. Blood pressure should be monitored at home if taking antihypertensive medications. Starting with very small amounts, a single teaspoon daily, allows observation of how the body responds before increasing to therapeutic doses. This gradual approach provides an early warning system, revealing potential problems while they remain manageable rather than critical. The fundamental lesson extends beyond chia seeds to encompass a broader truth about natural foods and supplements. The designation of something as natural carries no inherent guarantee of safety, particularly when combined with pharmaceutical interventions. Many of the most powerful medications derive from natural sources, digitalis from foxglove, aspirin from willow bark, yet no one would consider these substances benign simply because they occur in nature. Chia seeds pack concentrated nutrients and biologically active compounds into tiny packages, making them potent enough to alter bodily functions significantly. That potency, while valuable in appropriate contexts, becomes dangerous when layered onto systems already modified by medication. The key to safe consumption lies in recognition of this power, in treating chia seeds not as harmless additions to smoothies but as foods requiring thoughtful integration into overall health management. Knowledge transforms these risks from invisible threats into manageable considerations. Understanding that dry seeds must be soaked prevents choking and blockages. Recognizing that moderation matters prevents fiber overload and digestive distress. Knowing that medication interactions exist prompts essential conversations with healthcare providers. These insights empower rather than frighten, providing the tools needed to enjoy chia seeds safely while avoiding the pitfalls that send others to emergency rooms. The seeds themselves remain as nutritious and beneficial as advertised, rich in omega-3s, loaded with fiber, packed with protein and minerals. But their benefits emerge only when consumed with awareness, preparation, and respect for their power to affect the body profoundly. In that careful balance between enthusiasm and caution lies the path to making chia seeds the health-promoting superfood they can be, rather than the silent threat they become when ignorance guides their use.